Everyone, this video is going to look at the reward and subsequent addiction that people experience when they consume cannabis and the other cannabis-related compounds like THC. So the first thing we need to do is we need to define what we mean by addiction, okay? So there are different definitions of addiction depending on who you speak to. So there is a medical definition of addiction, which includes, by definition, a loss of control of use, meaning that the patient cannot control themselves, that their activity where they seek drugs and take drugs interferes with their ordinary life. So even if somebody feels like they need the drug, but they're able to compartmentalize it and it doesn't interfere with their life, that does not meet the medical definition of addiction. And the third part here is that these people cannot stop taking whatever they're addicted to, despite being fully aware of the negative consequences of continuing to take it. Think of cigarette smokers. They know that they're putting themselves at increased risk of lung cancer and other diseases. However, nicotine is extremely addictive, and so even though they know the negative consequences, they cannot stop themselves from continuing to consume nicotine. When we use addiction in real life, we are not talking about the strict definition that the medical field applies. When we talk about addiction, what we're talking about is a spectrum. I mean, people say that they're addicted to nicotine, and in that situation, it may meet the medical definition. People say that they're addicted to opioids or addicted to cocaine or anything else. That may meet medical definition. But when people say that they're addicted to chocolate chip cookies or they're addicted to caffeine, in most likelihood, that does not meet the medical definition of addiction. In terms of caffeine, there may be some aspects of it, but you are not going to most likely find a person that meets all those three criteria for the medical definition in terms of caffeine. Originally, cannabis was thought to be non-addictive, and some people still believe that to be the case. However, we'll see that cannabis is, in fact, addictive. And another thing to keep in mind is there is such a thing as cannabis use disorder. So cannabis use disorder is the textbook term for someone who is addicted to cannabis. We don't say that they have a cannabis addiction. We say that they have cannabis use disorder. And you can probably see that there's a slightly different angle here. Cannabis addiction, at least to me, seems more biological or physiological, whereas cannabis use disorder focuses more on the use of cannabis rather than the cannabis itself, and so it's more psychological. Cannabis use disorder, while it does in fact exist, is generally not as severe as other drugs like opioids and cocaine. However, it does make up 24% or almost 1/4 of all substance abuse patients. Now, there are a number of potential causes for that high percentage, right? Cannabis use rates are very high, partly because it doesn't have nearly the side effects of other drugs. It doesn't have nearly the addictive capability as other drugs. And so use is higher, and so there's going to be a fair number of those people that are in substance abuse programs for it. Another part may simply be societal. We're seeing that, yes, cannabis is certainly something that has downsides to it, but it's not horrible, and there are plenty of potential medical upsides to it. However, portions of society still see and lump cannabis together with other drugs. Particularly, think about at the federal level. Someone who is prosecuted for cannabis possession or use may be forced to go into substance abuse programs for cannabis, even if they don't have an addiction or maybe even cannabis use disorder. Something that we tend to associate with addiction is withdrawal symptoms. And there is, in fact, withdrawal symptoms when we withdraw cannabis or THC from a patient. It generally doesn't show up until 1 to 2 days after discontinuation. So this is not something where someone has to take it every 8 hours, and if they miss their dosage by a couple hours, they start to feel withdrawal. That's not cannabis. Partly because, remember, THC stays around in the body so long. Withdrawal symptoms tend to peak between 2 to 6 days after discontinuation. That's going to depend on a lot of things, depending on how much THC is residual in the body. It's also going to be dependent on the individual. But the withdrawal symptoms are exactly what you would expect them to be: irritability, chills, maybe a little bit of paranoia or anxiety, the things that you would normally associate with withdrawal. If you take a patient who is suffering from cannabis withdrawal and you give them THC or some other cannabinoid one receptor, CB1 receptor agonist, you're going to reduce the symptoms. However, interestingly, if you give these patients agonists, it doesn't cause them to relapse. And so it's kind of a no-lose situation, it seems. If we give them agonists, it helps them overcome the withdrawal, which would then in turn help them kick their addiction or their substance abuse disorder. So if people are capable of becoming addicted to cannabis, there must be a reward mechanism associated with the consumption of cannabis. Because the way addiction works is there's administration, a reward pathway, and then over time that reward pathway reinforces something physiologically that results in addiction. So we have a few ways that we can measure the reward outcome of cannabis administration. So we're going to focus, at least at first, on animal models. So So in this situation, we have a rodent. This looks like a rat. We do the same thing with a mouse, though. And simply, they are hooked up to a syringe that contains THC or some other agonist. And then they're given access to a lever. And simply, when they push the lever, the syringe gives them a dose of the drug. And so you can imagine that if the rat realizes that if I push this lever, something pleasant happens and they receive a reward, they're going to learn to push that lever to give themselves the reward. However, if whatever is in the syringe is non-rewarding, they're not going to learn to press the lever. What we find is that if what is in the syringe is low doses of THC or endocannabinoids, the rodents will in fact self-administer it, meaning that they're receiving some sort of reward for doing it. However, if there are high doses, particularly of THC, they do not. This comes back to the biphasic effect of THC. High doses of THC will have very negative feelings or cause very negative feelings in the mouse or the rat. And so in that case, not only do they not learn to push the lever, they learn to not push the lever due to the adverse effects of the high doses of THC. Another way to look at this is place conditioning. And so in this situation, we have a box sitting on the table, and on one side, there are lines going horizontally in the box, and on the other side of the box, or the other end, the lines go vertically. And so an animal standing in this box can tell which side of the box they're on based on which direction the lines are pointing. And so what we do is we put a mouse or a rat in one side, we'll call that the experimental side, or the drug room here, and we're going to give them the THC, or whatever else we are experimenting with. Other animals, we put them over on the control side, and we inject them with control, usually saline or something like that. We do that over and over and over again until they learn to associate, when I receive the drug, I am on this side. When I receive the vehicle, I am on that side. And so, if the drug is rewarding, they associate the reward with the drug room. If it is not, they don't develop an association. So what we do is then we simply put them in the center of the box and see which side they go to. If they go to the drug side, that means that they associate a reward with that side of the box because of the THC or whatever else we were administering. If they just kind of move randomly, that means that they didn't associate anything with anything, and so they just move around randomly. If they go over and prefer the control side, that infers that they associated the THC or the drug with a negative effect, something that they do not like, something aversive. And like we saw before, low dose THC is rewarding, causing them to want to be on the drug side of the box, and high dose THC is aversive, causing them to want to be on the control side of the box. Interestingly, though, if we use metabolism inhibitors, these are the drugs that inhibit the MAGL and the FAAH, which causes an increase in the endogenous endocannabinoids, that doesn't seem to be rewarding. And so it seems like it requires exogenous amounts of drug to cause this reward response. That simply increasing or maintaining the endogenous levels of endocannabinoids does not either reach the level required for the reward or does not get the agonist to a portion of the brain required to initiate the reward response. So speaking of brain locations, how does this reward system work? Now, I am not a neuroscientist, so I am not going to expect you to be neuroscientists in this course, but we need to understand enough for us to understand what is going on with the cannabis. And so with cannabis or any other rewarding drugs, the result is an activation of the dopamine system. Dopamine is a rewarding neurotransmitter. And so the drug has to activate the dopamine system, which then causes a pleasant response, the reward leading to the addiction. Endocannabinoids are going to activate the dopamine system indirectly by inhibiting glutamate and GABA. So remember, this is what endocannabinoids do. They inhibit glutamate neurons and GABA neurons. In both situations here, it is actually going to indirectly activate the dopamine system. So on the right-hand side, we have a simple diagram of this reward system. And so the primary portion is in the ventral tegmental area, or the VTA. This is where the dopamine is primarily located. But we also see that it is controlled by the nucleus accumbens, which includes GABA neurons, and the limbic system, which includes glutamate neurons. So there is crosstalk between these brain locations. So the endocannabinoids are going to have their primary function in the limbic system, in the nucleus accumbens, but the result is an activated dopamine system in the VTA. Cannabis, though, doesn't seem to have this simply indirect effect. It looks like it may, in fact, somehow directly activate the dopamine system, but the experiments have been inconsistent. In some situations, it seems like they activate the dopamine system directly. In some experiments, they don't. So that's something that certainly requires a little bit more work. In animal models, cannabis does seem to activate the dopamine system and inactivate the sub-regions here, but it seems to be only in specific circumstances, and what those specific circumstances might be aren't fully worked out yet. But in animal models, where we have a little bit more leeway in what we're able to do, it does seem that cannabis is activating the dopamine system. What about relapse? A relapse is when someone weans themselves off of an addiction, but then later on comes back to it. Someone who has beaten addiction is usually more likely to become addicted to the same thing than someone who was not previously addicted. You may have heard the saying, once an alcoholic, always an alcoholic. That's an Alcoholics Anonymous saying, I believe. And it's simply explaining or reinforcing this fact. Someone that beats an addiction is unfortunately more likely to re-pick up that same addiction. And CB1 agonists clearly promote relapse. Okay, so this is going to include the THC in cannabis. This causes cue-induced drug-seeking behavior. Think back to an alcoholic. People who have gone through Alcoholics Anonymous or have beat alcohol addiction tend to say or feel that they need to avoid going where people are consuming alcohol. Because if they see people consuming alcohol, that acts as a cue in their brain that causes them to undergo this drug-seeking behavior where they then consume alcohol and relapse with their addiction. Same thing happens with cannabis or CB1 agonists. However, what's very, very interesting and a bad thing is it seems like CB1 agonists promote relapse of all other addictions. So someone who has beaten an alcohol addiction or a cocaine addiction or an opioid addiction, their exposure to CB1 agonists can cause them to relapse on their previous addiction to a different drug, which is a very dangerous thing. I have heard people say that they are trying to step down their drug use by going from what they consider a hard drug down to cannabis. However, you can see here that doing that may not work very well because the consumption of the cannabis can lead to them relapsing. However, if CB1 agonists promote relapse, CB1 antagonists may help prevent relapse, and we do see this. Remember rimonabant, that is a CB1 antagonist, and we have seen, particularly in animal models, that it has promise in preventing drug relapse. Again, regardless of the drug, but rimonabant has psychoactive side effects. This is not a harmless drug that we can simply give a person willy-nilly. This has issues. However, CB2 agonists and CBD seem to show some of the same relapse prevention, but they are not psychoactive. And so it's more likely that drugs in the future will focus on the CB2 receptor or the use of CBD to prevent relapse without the psychoactive side effects caused by a CB1 antagonist. Now, I mentioned that cannabis can cause relapse of multiple other drug addictions, including opioids, but cannabis and opioids are linked closer than that. We're just now realizing how closely they may be linked. There is crosstalk between the cannabinoid receptors and the opioid receptors, meaning that activation of the cannabinoid receptors can activate the opioid system. And activation of opioid receptors can activate the endocannabinoid system. Likewise, rimonabant, the CB1 receptor antagonist, can actually block opioid signaling. In 2017, there were over 47,000 opioid overdose deaths in the U.S. That accounts for 2/3 of all overdoses. That is not simply prescription opioids. Heroin is an opioid. And so these opioid deaths include both prescription opioids and heroin. So because cannabis activates the opioid system, we can use cannabis to potentially reduce the withdrawal symptoms of people that are trying to get themselves off of opioids. Cannabis is considered a safer drug than opioids. And so in this situation, we might be able to use cannabis as a step down. However, there is still that potential that the cannabis is going to, on its own, cause relapse. So it's a matter of doing clinical trials to figure out what is more effective. Going cold turkey, where you don't risk that cannabis-induced relapse, or using the cannabis to reduce the withdrawal symptoms, and so increasing the likelihood that people are able to wean themselves off. So that is clear that cannabis is addictive. Okay, it is likely not as addicting as many other drugs, but in fact, it is addicting. It activates the dopamine receptor, and it has other effects on addiction of other drugs. Hope you found it interesting. Go ahead and move on when you're ready.